Exposure to psychosocial hazards is not the same as a mental health crisis. And a mental health crisis is not necessarily a diagnosis of mental illness, but there are connections between the three. We'll talk with a mental health professional about the differences and connections in this episode of the Psych Health and Safety USA podcast.
From Flourish DX, this is the Psych Health and Safety USA podcast. Safety at work is more than freedom from physical injury. To be safe, you have to feel safe. Join us each week as we discuss psychologically healthy and safe work in the USA.
Well, welcome to this episode of the Psych Health and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each week, we seek to increase the knowledge and awareness of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. So in pursuing strategies to reduce harm and reduce vulnerability, it's important to remember that not everyone is impacted by the systems that we have in place currently the same way. As a matter of fact, so I come at this conversation as an occupational safety and health professional, got some background in the public safety space, but I'm not a mental health professional. I'm not. As a matter of fact, I think I have some ideas around how to help people not get exposed to psychosocial hazards. But in terms of how they affect people emotionally and mentally, I think it's important that we have people actually understand that. And there is a connection between a psychosocial hazard, between mental health and mental illness. They're all kind of separate but connected things. So rather than me just kind of make this up as I go, I thought it's important to get some folks, and particularly today, to get someone who has an understanding of kind of some of these differences and also can speak to how these systems, again, it's not that the systems themselves are bad, but these systems don't necessarily work for everyone. They don't necessarily function for everyone the way even they were intended. So let's get into that discussion today with the question that I ask everyone who comes on this podcast. And in this case, who is Lisa Jones-Chandler?
Thank you so much. Let's see. Lisa Jones-Chandler. I am a Caribbean girl from Brooklyn, New York, with Bajan and Trinidadian roots. I am a first-generation American. I am a wife, mother of 2 children under the age of 7. My son will soon be 1 in a couple of weeks. And I'm also a clinical social worker. And I really fell into that career by way of studying psychology. And I currently am overseeing corporate compliance, quality improvement, and equity at a nonprofit behavioral health organization in New York City.
Wow. So now, we could have this conversation from any of those perspectives because
Absolutely.
all of those perspectives are different. So as a young mother, as the mother of a 1-year-old, as a first generation, so your family came here from another country, that's a whole thing that we can talk about. But before we dive into whichever one of those we choose to pursue, when you hear the concept or the set of terms, psychological health and safety, what does that mean to you?
For such 2 terms, right? They mean so much. And I think that when I hear psychological safety, I think about authenticity. I think about the ability for someone to show up as their true selves, mind, body, soul, without being concerned about harm. That's what it means for me. How can this person ensure that they are moving, engaging life and in a world that sees them for who they are and accepts them for who they are.
Mm, mm. Yes. And again, that I asked that question, not necessarily looking for some textbook definition, but looking for, how that feels to people. As you probably know, we don't, at least in the United States, we certainly don't have a lot of regulation around how people get treated at work or get treated any place, to be quite honest. I mean, there's certainly some criminal kinds of things that one could do, but
Right.
you can treat people at work kind of however you want, as long as you don't put your hands on them. And in a lot of places you can get away with it. And unfortunately, uh, that that kind of open, you can do whatever you want kind of perspective leaves a lot of people. And again, I don't believe that it's always intentional, but it doesn't matter intent. It matters, I think you said before you came on, it matters impact, because well-meaning people
Mhm.
can harm others
Yeah.
with their deeds, with their actions, with their systems, with their so talk a little bit about that thing, because you were chatting a little bit about it before we came on, about the difference between what we intend to do and how people feel about what we do.
Mhm. Yeah, I think, we listen, when people think about systems and policies, right? I always laugh because we make up the system. We are it, right? Humans make that up. And so, we were, talking before getting officially started about how, we have all this idea that we are all good people, right? Like that is genuinely how most of us engage and interact with each other. And there are times when good people don't do good things. And those two things are very separate. Sometimes there's a struggle, though, for people to differentiate the two. And if you say to them, hey, like, I just want to point out some observations I've made on how what you said landed for me, or how I experienced what you said. Now, depending on the person, right? They could either hear that and not personalize it and compartmentalize it enough to hear you're speaking specifically to the behavior that is being discussed. And then there are other people who cannot hear that and may take offense or defense and say, oh, I'm a bad person, and then sweep their entire being into this feedback, right? And so, it's mindful to know where you fall in that in terms of, are you someone who can really hear and receive the feedback, not personalize it and say, I'm keeping this separate? Or are you someone who at times will conceptualize it to mean, oh, this is who I am as a person. I need to now look at who I am overall as a being. And those, listen, many of us fall into two different buckets there, right? And so when I start thinking about intent versus impact, we as a society, we prioritize intentions. We are going to do this thing, and the people we're doing it for are going to love it. How do you know that? Did you ask them?
Mm.
Really? And you'll be surprised whenever I ask that question. Did you ask them? And they're like, oh no, we didn't. We just know that they're gonna want it. And it's, but how?
Right.
Right? Where are you forming those ideas and thoughts from? Right? Is bias playing a impact there? Prejudice? Like, how do you know that they're going to want this thing? Why not include them? Right?
Right.
And so then you can start to really unpack the impact. Okay, well, did you check with them? Did you see how that landed? How was that for you? Right? Just that to me promotes psychological safety in terms of, can you give me some feedback here? We are also a society at times where we don't ask for for feedback, right? We're just
Right.
very, you're going to do this because I said it was good for you to do.
Mm.
That in itself is harmful
It
if
is.
you're not including that person's lived experience, how their identities and cultural capacity impacts who they are as a person. How do you know? How do you know? You know?
You make me think of a concept I heard recently, and it makes a lot of sense to me that we opt for power over instead of power with.
Mhm.
So that when we have that option, we go for this thing that, for example, if I'm in a quote unquote leadership role, my job is to tell people what to do
Yeah.
or to do things for people.
Mhm.
And what's really more important is not doing things to people or for people, but doing things with people.
Right.
Because if it affects me, I should have a voice in things that affect me.
Absolutely. Why
And
not?
and I realize that, at least people will say that, this is a Judeo-Christian culture. Yeah, some people are. And some people do believe in the golden rule, do unto others as you would have them do unto you. I personally believe more in the platinum rule, do unto others as they would have done to them, which means I have to ask. I can't assume
Yeah.
that you and I, just because, even if we have the same faith traditions, the same gender identity or not, the same racial, ethnic back, whatever, we can't make assumptions that the other person sees this same situation the same way. Just can't.
Yeah.
And then, and then be surprised when it somehow lands differently
Yeah.
with the person, even though my intent might have been good in my own eyes. So you mentioned about studying psychology, and then tell me a little bit more about exactly how you because there are a lot of different people there, sociologists and psychologists and psychiatrists and all these ISTs. So what is it that your education and background have you doing in terms of helping people in this space?
Oh, sure. Yeah. And so you're right about that. When people ask me, they're like, well, what's the difference? They are all related disciplines that ultimately focus on the well-being of people. Now, some focus on the individuals and some focus on the community. And so, psychologists primarily, this is a very broad and general paintbrush I'm using, focuses on the individual. And I went to study clinical social work that really focused on the community and the system as a whole and what it looks like as it relates to psychosocial stressors, what comes up systemically for groups of people. Because again, that has ties to policy, that ties to how we live and treat each other as a society, right? And so there's beauty in both, right? Because individuals make up the society,
Right.
right? Similar to like what we talked about with systems. I went on to study clinical social work primarily because I was curious about the community at large. You'd be surprised after having a few conversations with varying people, different race, gender, religion, and at the core of it, we're all saying the same thing, right? This constant need, desire to be understood. That is human behavior at its core. And so I went to Howard University for graduate school. And so that's where I really cut my teeth as a social worker and learning how to really impact and serve. I really believe that if you're in a mental health profession, you are in a service to people.
Yes.
And you talked a little bit about power, and I really appreciate what you said about that, because a lot of times we don't talk about the role that power plays in the workplace.
Right.
When we are in a very hierarchical society and it plays out in the workplace, right? Who do you report to? Who's your supervisor? Who's your boss, right?
Right.
And so not really understanding the beauty and that real power is shared, right?
Yeah. Yes.
And it like, I view everyone's a leader. It doesn't matter what your title is. And sometimes that way of thinking confuses people. But whether my title is janitor or director, I'm still a leader in varying capacity, right? And so I think that when we start to move to create psychological safety and recognizing that all people, anyone, can be a leader because they are the expert in their life, in their shared experience, that's really where we start to come together to create psychological safety, because it's not I'm the expert and you're not, right?
Right.
I am a mental health professional. Yes, I have clinical training and degrees and experience that lends from my point of view, but that makes me no more of an expert than someone who has been living with depression all their life.
Right.
Because you are the expert of your life. And that is a very radical approach. It's not in its entirety to how I was trained in the field of psychology and psychiatry. But one of the things I do with my clients is I say, you are the expert of your life. I am simply here listening and paraphrasing what you said you wanted to work on, and we're coming up with the plan together. It is not, I'm telling you what to do. It's not any of that. Because the goal is self-sufficiency. We want people to live the best versions of their life and themselves without help, right? Like
Right.
that's, to me, that's the ultimate goal. You shouldn't have to need someone to constantly tell you how to live your life.
Right.
And when
Right.
people hear of going to therapy or a psychologist, it's like, oh, I just want someone to tell me what to do. And I was like, ooh, you're going to be surprised, because
Right.
one of the first rules we're told, we don't give advice. It's a shared experience between a professional, a provider, and the person who is in need of service.
Yeah, you are causing me to recall some things that my therapist has told me. and
Same.
yeah, really, it's because you talked about this kind of hierarchical society, and the hierarchy is particularly virulent, if that's maybe the wrong word, but it's particularly impactful for those of us who our differences have been highlighted a lot. So again, women and people of color and the disabled and the LGBTQ plus community and the whoever, it's people who have not fit the traditional white, male, cisgender, able, blah, blah, who've checked all the boxes. And again, I think we've sold ourselves short as a society to pick one group of people and create everything to fit them and somehow try to make everybody fit that box. It's kind of like ergonomics. Ergonomics is about fitting the work to the person, not the person to the work.
Right.
But that applies to everything. We should be fitting systems around people, not trying to force people into things that don't work for them. And I think we're also missing out on business opportunities and educational opportunities and entertainment opportunities when we say there's only one way to do it. There are multiple ways of doing it, multiple ways. And your way and my way may seem different, but we may both enjoy finding something in the middle. So I can't say I've ever had this conversation with someone who looks at a mental health kind of professional who does look at systems as opposed to just people, because we often hear is it's the person. The person is depressed. What are we going to do about the depressed person? And the way I look at it from a work perspective is, so now what are we going to do about the things that are going on around them that are contributing to their depression, that are contributing to their anxiety, that are contributing. So talk more about that whole, particularly when we're talking about work. There are things that employers can do, right? Aren't there?
I mean, yeah, like, just something as basic as, being honest and, being consistent with your word, and really looking at the behaviors that influence and contribute to culture. Culture isn't just like something I can go buy at the store. Like it is a pattern and series of behaviors that ultimately lend to culture, right? Like one of my favorite quotes is culture eats strategy for breakfast,
right.
Because it does, right? Like you could, I'm going to go in, I'm going to do all of these things. And then when you get there, right? I know this has happened to you in the workplace. You start talking to a few people, you do a few listening tours, and then you quickly see how the work really gets done.
Right.
And that's where you start to really see where culture fits and how it really controls a lot of productivity or not. right?
Right.
And so there are many things that employers can do by simply just being who they say they are and looking at the culture and holding people accountable, including themselves, right? Like
Right.
I've spent a lot of time in the hospital sector, and also nonprofits, and you often hear people talk about, okay, well, what works for me? They'll hold me accountable, but they won't hold someone else accountable
Yes.
with a higher title. That does not create psychological safety. That's actually a psychosocial hazard, right?
Right.
When the expectations aren't clear, when the role is confusing, when you're not honest, when you shame or belittle people publicly, you talk about people behind their back, and you don't bring that as a place to say, this needs to inform the culture we're looking to change and to shift. Who are we really as people? That's where a lot of the trouble is. I think we as humans overcomplicate things. What can we do? Oh my goodness, we need to do this new thing. No. Start with what you said you were going to do. Are you doing that?
Right.
Like, that's like a real basic assessment question. What are your rules and policies in place? Are you doing it? No. What are the barriers? Are you doing it? Yes. What is working well? Just very basic questions in terms of how are we cultivating what we say we're going to do. There's a lot of performance happening, right? And I've said to people, sometimes employers are held accountable by people leaving. That is a form of accountability.
It is.
Right?
It is.
Not all people move on because they're retiring and they're getting a new opportunity. They're leaving toxic bosses, toxic work environment, right?
Yes.
And it's a shame, to your point about we haven't done enough as a society to really define psychological safety and to really talk about how we operationalize it. And what does it mean to hold people accountable? And I think, though, in the last 2 to 3 years with COVID and the uprisings that have happened as a result of George Floyd's murder, I think there is a different tide happening where
I agree.
employees don't want to tolerate it anymore. They are saying, this is what you said your mission was. This is not in consistency with that, right? I sometimes talk at work about being a critical lover of my agency, and I've been there for quite some time. And I am very vocal about the things we do that are wrong. And it is not because I don't enjoy what I do or I don't enjoy my employer, but again, we make up the company, right?
Yes.
And so we have to be able to say, we're off here. Let's look at this way. And so when you don't do that, when you create this, like to your point earlier about we've kind of created this system where everyone has to meet this one standard. Where's there room for cross collaboration? Where's there room for ideas? Where's there room for exploration and innovation when everyone is the same, look the same? Where is there room for that? There's my compliance hat. Like, I actually view that as risk, because if you have everybody around you saying and doing the same thing, then where's the difference?
That's called groupthink.
It is, right?
It
and
is.
So where are we in wanting to be innovative? Where are we in saying, it's a little bit too much the same here. let's shake it up a bit, right? And I think that takes a little bit of confidence, but also trust, right? What we're really talking about is trust.
Right.
And the fact that we're not able to sometimes trust our employer or people that we report to or our colleagues is due to that. There's a lack of trust there.
Hi listeners, Jason here. We hope you're enjoying this latest podcast episode. Now, if you're like Joelle, Alicia and myself and enjoy learning from the best, then the Flourish DX Academy is for you. The Academy includes free e-learning courses on the ISO 45003 standard for psychological health and safety at work, and associated topics such as how to conduct a psychosocial risk assessment and how to create the business case for psych health and safety. All courses feature high-quality videos, downloadable resources, multi-choice questions, and a downloadable training certificate on completion. Take your learning to the next level with all Flourish DX Academy courses included within the Flourish DX mobile app. Select podcast episodes from the Psych Health and Safety podcast and sister podcasts from Canada and the USA are also included. Get started with Flourish DX for free at www.flourishdx.com/get-started. That's www.flourishdx.com/get-started. Now back to this episode.
Yes, absolutely. Yeah, and it would be wonderful if everybody could be a startup and everybody could kind of start from scratch. That's not reality. I did a little bit of construction before I went into the fire rescue service, and I can prove to you new construction is a lot less expensive than remodeling. But it is necessary sometimes to do one or the other. Sometimes you can't start that from scratch. You can't. But even if we're going to remodel it, the people that we want to benefit from it, to enjoy it, to make profit, whatever, their voices need to be involved when we start the project, not when we get finished. So we go in so we're going to remodel someone's bathroom. We go do it. And then we come, hey, come take a look at what I did. No, we should have that conversation beforehand. Are we going to have a walk-in shower? Are we going to have a bidet? Whatever it is we're going to have in.
What is the plan for this room?
Exactly. So, and again, going back to that whole issue about power in an organization, it's as if people feel like that, well, I'm the CEO, president, whatever it is, and I have the final say. Why? But you can't do it all by yourself. So why would you try to design it by yourself? You said you hired these people. You said that they were skilled and qualified and all this type of thing, but then you reserve the final decision for yourself. But as you said before, it depends on which decision it is. Mm-hmm. There are some decisions that you probably don't need to be involved in at all. Let people, or create an environment. But create an environment where people feel confident. This is my job. I shouldn't have to go ask anybody to do this thing, to accomplish this goal, because ultimately I know how it fits into the grander scale of the organization. So I wanted to make sure that there's another activity you're involved in. Unfortunately, for some, they because of all kinds of things going on in their lives, there are some people who feel that the only way to free themselves from their pain or whatever it is to self-harm themselves, and either to even kill themselves in some cases. Mm-hmm. As a matter of fact, I've done some and continue to do work with fire rescue services, and it is one of the top reasons that public safety folks lose their lives now is they take their own lives.
Oh my goodness.
And there's a resource that you're affiliated with. I want you to share a little bit more about it. So tell me more about 988.
Oh, absolutely. So 988 is the expansion of the National Suicide Prevention Lifeline number. And so for those who may know it, if you read an article, watch a movie, on the news, there's coverage of someone who unfortunately may have decided to die by suicide, you may see the number, before it was 800-273-TALK. And so through lots of community, clinical advocacy, and political advocacy, we now have launched 988, which is an expansion of that same number, but really realizing that when you are in distress or crisis, it is really hard to remember 10 digits. And so how can we simplify this process in a system in this country that has been highly talked about, highly scrutinized in terms of our mental health care service delivery system in this country? What can we do for people that can make the number easy to remember in moments of distress? And so 988 was launched last July. It is for anyone seeking emotional support, right? And I think at times we primarily focus on the people who die by suicide, but also there are so many people who think about that every day, who are stressed out about losing their job, who lives with someone they care about, who is incredibly anxious. There are a myriad of reasons why we are often upset and distressed. And so 988 is a line, is 24/7. It is answered by trained counselors in the fields across varying disciplines, to say, hey, we are here for you. You're not alone. Talk to us about what's going on. It is also a resource portal, and so can provide those who are calling, texting, or chatting with resources that they need either for themselves or for a loved one. There are times when people call us and say, hey, I've just made an attempt on my life. I think I've changed my mind. We are able to collaborate with local authorities in attempts to get them the help and support that they need. But primarily, the line is for people who need support, everyday support. And so you're right. A lot of people are not aware of it. And so we want to get as many people aware of it as possible to say, hey, I'm not calling for myself. I'm calling for someone else. That's not uncommon, right?
Mm.
You ever notice something's off about someone you love or care about, and you don't know where to go? You don't know, you don't want to talk to someone else who may know them, because now you have to worry about, are they going to go back and tell the person? And so it also allows for this place of neutrality and privacy to say, hey, I think something's up with my friend. This is how they're looking. How can I support them? What are the resources out there for me as a loved one to support my father, my sister, my brother? Again, resource portal. There are family groups, there are friend groups happening nationally and on a local level for many people, and they just don't know. They have no idea about it. So that is 988.
That's wonderful, because that even helps me when I'm, sharing with others about resources that are out there. That it is, you don't have to wait. You don't have to wait until someone is at that point of crisis that they're considering taking their life.
Right.
This resource is available when you're feeling kind of down and don't have anyone to help you get to a place where you're a little bit more stable emotionally. So one of the things that comes up, and I'd really love to have you share this again from a professional, the difference between mental health and mental illness.
Oh, that is a very popular question. We use those words interchangeably as a society, and they're related. That's, but I look at it as a spectrum, right? And so when I think about mental health, I think about the overall well-being of someone, right? How are they living their best lives to the capacity that they're able to do so? When I think about mental illness, I think of it in terms of a disruption of some sort. Something is impacting or getting in the way of how you are functioning on a day-to-day basis. And to take it a step further, because again, I'm a clinical social worker,
Mm.
I'm viewing it as a disruption in the primary areas of your life, right? So that could be your relationships, that could be at work, that could be how you cognitively function, how you think, right? I'm always asking people, what's going on in the workplace, right? It's where we spend the majority of our waking hours, right? So I can't imagine that someone, and it's not impossible, but for someone's life to be in complete shambles at home and it not show up in the workplace.
Right.
How would that happen, right? And it's why when you say there are things employers can do, it's probably why we've started to notice a lot of employers incorporate an employee assistance model or EAP to kind of acknowledge this idea of, oh, sometimes what's going on in your home life can absolutely impact how you show up to work. It impacts your productivity, right? Sometimes you work with people and maybe someone is going through a separation. That is absolutely going to impact your concentration, your sleep, how you focus at work, how you engage with other people, your irritability. That is going to happen, right? We are not robots.
That's right.
And I
That's right.
think what I hope we move away from is getting more clearly defined on how we support our employees without thinking that supporting our employees doesn't also mean that we also need to hold them accountable.
Sure.
And those two things are not always different. And I think sometimes when we know what's going on with someone and their performance is bad, sometimes as leaders, we are not going to talk to them about the performance being bad. And that's actually a disservice to people.
Yes.
Because
Yes.
again, we're going back to honesty and trust. And if you're not being honest with the person to say, hey, I think you might need some time off. I think this stuff is impacting you a little bit. How can we support you? If you're not doing that, then I don't know what you're doing in the workplace, because now this person has been set up for failure.
Right.
And we haven't led them in any way that is meaningful.
Right.
And so support and accountability to me are the same.
They
They're
are.
not different. But you can imagine when I say that, like the light goes on for people at times in terms of, oh, well, you just told me my performance was bad. You must not like me, right?
Right.
And no, I'm actually supporting you. So you know where I stand. So we know together and we can work on a plan for you to improve.
But so this does definitely go back to your doing what you say you're going to do, because I find so W. Edwards Deming said that if a system is not producing what you expect it to produce, that 95% of the issue is the system itself. And what I find is systemically is people aren't told when they come into these organizations, new roles, whatever, what they're supposed to do until they don't do it.
Yeah.
And then that's the time we want to have the conversation about accountability. Accountability to what? So it's doing what you say you're going to do. And if you did not, if no one ever shared with this person what it is they're supposed to do, when they don't do it right the first time, that's not the time to, you should have, how am I supposed to know that? I mean, so that goes under that umbrella of working together. We both have a role in this.
Mhm.
And if you're serious about this psychological safety thing that's trendy for some, the whole person brings depression with them, brings anxiety with them, brings my grandmother's sick with them, brings I have a bill I can't pay. All of that is a part of that whole person. And you can't simply expect that, but they can leave that at home. They can't. That's a part of me. And employers who get that and understand that are able in those circumstances to be able to, this is a whole person. It might seem interesting and different to me, but this is real for this person. If I care and really want to get the best out of this person, how can I support them?
Yeah.
How can I get them through this? To include having them talk with folks like you, because they may never have done that before. They may never have done that.
And support doesn't mean fix the problem.
It does not.
I also think that part of the hesitation too with many people is that when you hear, we don't allow a lot of space for discomfort when people are hurting, right? We don't hold them in it. We quickly move them to solution based conversations when sometimes people just may want to vent or share something and move on. And I get that this is tricky in the workplace because that is not ultimately what you came to work for. It is, however, an acknowledgement to say, I see you. I see you bringing your whole self to work. Let me know how I can support you. Do you need us to go to HR together?
Mm.
Here are some resources as a part of your benefits package. Many employees sometimes forget their benefits.
They
Like
do.
they forget what is being offered to them that the company pays a lot of money for.
Right.
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 And so there are times too, I'm like, did you know we have EAP? Like, and they're like, oh no, wait, what is that? Oh my gosh, I can get a certain amount of sessions for
Yes.
free.
Yes.
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 Yes, you can. Your job is paid for it, right? And it's an underutilized resource, right? And so having to remind people of that while also holding them to say, this project is due here. Do we need to collaborate with someone on it?
Right.
Do you need an extension? Like
Mhm.
that's support. Support isn't you don't have to do any work,
Mhm.
right?
Right. Right.
Like
Right.
that's not what that is. It's what do we need to get you through what's happening? Do you need to
Yes.
take some time off? Are you aware of the benefits that come with that? Are you
Mhm.
not? Like it's about a conversation. And sometimes, sadly, we're just moving so fast, depending
Right.
on industry you're in,
Right.
that these conversations are like a dream to
Right.
have, right? And the room for allowing people the space to make mistakes
Yes.
is rare.
Yes.
Especially in my field, right? I work in suicide prevention, and there's this we often say, like, we work with people in crisis, but we're not in crisis. Like, sometimes there is this parallel process that's happening where providers in the field are moving just as fast, and we have to remind ourselves sometimes, like, okay, slow down.
Yes.
Like, it's
Yes.
all right to slow down right now. And I'm often having to do that. I'm in compliance. Everything is sometimes a fire that I
Mm.
hear. And I have to tell myself, well, is it smoke?
Right. Right. Right.
Because everything can't be, this, like
Right.
everything
Right.
cannot be a fire. Right.
That's right. That's right. That's right. Yeah.
Right. But
Yeah.
it's how we perceive it and how we respond to it.
Mhm. Mhm.
Right, is really key, and having the wherewithal, the self-awareness to say, okay, this is my stuff.
Well, so since you brought this up, I can't help myself. The occupational safety and health person in me
Of
says,
course, of course.
it says, what do you do, you and folks who do what you do, what do you all do to take care of yourselves?
Therapy.
Okay.
I mean, I think that there's no really doing this work without first of all, me taking my own advice, but also knowing how important it is to check in on myself. And listen, therapists need therapists too. And
Right.
we have friends who are like, are you doing okay? Because you sound like
Right.
you're not, right? Ensuring that I am connecting myself back to the things that bring me joy, the hobbies that really, really make me like thrive and excited and don't feel bogged down. Because in our line of work, right? You too, it's heavy stuff.
It is. It
It's
is.
heavy, and you have to be mindful to not let it consume you and to be passionate about it just enough to have a boundary.
Yes.
Right?
Yes. Yes.
And that's really key,
Yes.
because if you've lost yourself in the work, then how do you know to pull yourself out? It's usually when I ask people, like, how do you know? Like, what will be your warning signs to
Yes.
yourself?
Yes.
Right. And so taking time off work, right? Saying I need to plan a 3-day weekend a month out,
Right.
right?
Right.
We are very interesting people. You tell people to take time off and they're like, oh my God, I can't, the work, it never stops. And yeah, well, the work never stops, right? So you are not the work. So,
Right.
so then you have to stop if the work doesn't stop, right? It gives you something to look forward to. I am my best person when I have good boundaries in the workplace. When I take time off, spend time with my family, I don't check my phone as much. I take my notifications off. I take my emails off my phone. When I come back to work, I am refreshed and rejuvenated, and I want to engage my colleagues. I care about the work a little bit more, and I just don't feel like it's everywhere. Right.
Right. Right.
And so you have to find these meanings for yourself. And yes, we all know, most of us, I hope, get into fields that we're passionate about and we love learning about. But who were you before that? Who are you in addition to that?
So again, that question I ask at the beginning of the podcast is not by accident, because
Oh, yes.
it is not by accident. As a matter of fact, there was a book that was written a while back that says there's a organizational learning disability. I am my position. No, you are whoever you are. You are a human being. Your work, your profession is a part of you, but it's not all of you. Because if it's all of you, that's really a difficult space to be in when work is everything. And this is why, I and others really would like to see here in the United States us do like 30 other countries who've done it, that actually mandate employers the same way we want you to have a safety management system that ensures that you don't get exposed to a chemical at work, that recognizes that I am going to expose these workers to psychosocial hazards. It is the job. You will be exposed, but what do we do about that? How do we help you be more resilient on the front end, give you information, help protect you from certain of these hazards, but then after they occur, how do we help you recover? How do we give you time off? It's the same thing that we would do, again, if you were exposed to a chemical at work, or if you broke your leg. It's the same difference, but we're not there yet. But
Don't do good with the things that are unseen.
yes,
Exciting.
but we got to
measure it. We can't measure it. And then all of a sudden, but when you can, it's similar. It's the same thing you talk about when you're like, what do you do when there's a chemical exposure? I use a similar approach with my clients. You are not your depression. You are someone who lives with depression. And this is what it looks like when the voice is loud. And this is what it looks like when the voice is low. You are not it. You live with it.
Right.
And it's so consuming. And because it can have such an impact on your life, right? We talk about mental illness, that pendulum swings between how healthy you are and how ill you are, right? And so I always, sometimes when I'm at work and I get sick, I said, oh, that's my body telling me I have not prioritized it. I have not slowed myself down. The minute I'm working too much, not taking time off, poor boundaries, I'm sick. Right? Last month, we were supposed to talk. I lost my voice. I had a full-blown sinus infection. I was burning a candle at every end. We were coming off the holidays and my daughter turned 6 a week before Christmas. It was just busy. And my body had enough.
Yeah.
And your body will tell you. It will tell on you when you have not prioritized it. And so I think too, we're coming out of what I hope is winter. I'm in New York City. We've barely had any snow, like no snow. And so what I hope is now moving into spring, like now it's not getting dark as earlier and people are like outside is 50 degrees. There's something to be said for the winter season and how people deal and cope with that, right? Where it's really dark, it's cold, they're isolating. We're learning how to socialize again in this like COVID, but not COVID world. And so I always, I just want to tell people to be good to themselves. And we're all going through similar things, right?
Yes.
And how much grace you allow yourself is important, because as someone, I've been doing this work for 23 years. I've spoken to hundreds of people. We are way more alike than we are different.
Right.
And there is a beauty in that, but also to your point about systems, how can we impact that in a meaningful way? We tend to not look at that.
Right. Well, I want to give you an opportunity to do a closer here. What's a closing thought you would like to leave to those who have been listening, that I'm sure have been enjoying as much as I have, what you've had to share. So what's a closing thought for those who are tuning in?
pay more attention to yourself. You are worth that.
Hmm.
We are often moving really fast. On to the next thing, next meeting, next thing to do. Slow it down.
Hmm.
Check in with yourself. How are you doing? Really? Right?
Hmm. Okay. All right. Lisa Jones-Chandler, licensed clinical social worker. It has been my pleasure to spend a few moments chatting with you. I've, as I often do, learned more about this topic, and I appreciate what you've been able to share with us. For those who you check in with us, once a week, once a month, whenever you get around to listening to the Psych Health and Safety USA podcast, I appreciate the moments that you spend with us. So go to, if you're watching on YouTube, like and subscribe. If you're listening wherever you get your podcasts, again, continue to subscribe and share what we're doing with your friends. We are on a mission to ensure that the culture of the workplace in the United States changes, that we pay more attention to how people are feeling at work, not just how they look. And what we've talked about today is certainly another important component. But again, we're gonna call it a wrap, and gonna go back to all the other things that we're involved in our lives. So again, thank you very much for spending some time with me, Lisa. For those who have been listening, thank you so much.
Oh, thank you.
Thank you, and that's it. Until the next episode, we'll see you next time on the Psych Health and Safety USA podcast.
You've been listening to the Psych Health and Safety USA podcast. To stay up to date with the best content on workplace mental health in America, subscribe wherever you listen to podcasts and join the Flourish DX community at www.flourishdx.com.